Multifunctional Gnathic device MGD34 is intended for gentle retention of the volume of opening the mouth during prolonged dental manipulations at a daily visit to a dentist, diagnosis of hypotonicity of the masticatory muscles, adaptive myogymnastics aimed at the prevention and treatment of hypotonicity of the masticatory muscles, supportive therapy aimed at correcting dysfunctional disorders of the masticatory muscles. The device includes an intraoral silicone block and an extraoral peripheral part. The intraoral block is a silicone, hollow, occlusal block of various sizes, having in its design the buccal and lingual shields between which the tension is located, and occlusal relief to hold the device in the oral cavity and prevent the device from displacement. An air pipe is connected to the intraoral unit and to an extraoral unit, containing a compressor, a digital pressure gauge, and a processor with the ability to remotely process data on a mobile device using our mobile application. The functions define the system components of the device. Gentle retention of the volume of opening the mouth during prolonged dental manipulations at a daily visit to a dentist. The system contains one intraoral device which is located on the opposite of the working side of the dentition, as well as an extraoral part with a compressor, an operating part to control the intracavitary pressure. Maintaining the volume of opening the mouth is carried out due to the structural features of the wall of the intraoral part, as well as the elastic properties of the main material, silicone. In addition, in work in conditions of hypotonicity of the masticatory muscles, when muscle fiber stretching is a difficult task, for example, for the patients with cerebral palsy, the use of intracavitary pressure, the device allows you to maintain the required volume of opening of the mouth throughout the entire duration of medical procedures. At the same time, the stress from prolonged tension of the chewing muscles at the dental appointment decreases. Diagnostics of the hypotonicity of the masticatory muscles. Using two intraoral blocks connected into a single system, which are located on both sides of the dentition. To date, the authors have worked out the following diagnostics methods. Determination of the volume of mouth opening by changing the air pressure inside the device. The advantages of this method are the objectification of the process due to digital calculations, the possibility of using the method regardless of the presence of teeth in any functional group. Determination of the force of compression of the masticatory muscles lifting the lower jaw, as well as the determination of their fatigue, which is an important factor for the early diagnosis of hypotonicity of the masticatory muscles. Determination of the uniformity of physiological development of the masticatory muscles. This method will reveal the asymmetry of the masticatory muscles work in patients, help prepare, determine an individual plan for adaptive myogymnastics, which will significantly increase the effectiveness of treatment of patients with hypotonicity of the masticatory muscles. Adaptive myogymnastics aimed at the prevention and treatment of hypotonicity of the masticatory muscles. Two intraoral blocks are used, located on both sides of the dentition, an extraoral part with a compressor, a digital pressure gauge and a processor with the ability to work remotely, to control the cycle of myogymnastics exercises, control the correctness of certain tasks, and the function of reminding about the need to perform exercises. The cycle of exercises is prescribed by the attending physician individually, depending on the data obtained at the stage of collecting anamnesis and diagnostic studies. It includes exercises based on the effect of post-isometric relaxation, aimed at both stretching the masticatory muscles and training, developing endurance. Supportive therapy aimed at correcting dysfunctional disorders of the masticatory muscles. It is performed by analogy with the complex of adaptive myogymnastics. The exercise cycle is prescribed by your dentist. Exercise should be done regularly throughout the year, depending on the clinical situation. All performed functions of the device are controlled using a remote device on a developed application for smartphones, tablets, PCs, where a patient profile is created and his individual data are displayed in dynamics, as well as the selected adaptive myogymnastics program. The device can be used both at the dental office and personally by the patient at home. The developed multifunctional Gnathic device has an official patent of Russian Federation, international patent, awarded with a silver medal of the 26th Moscow International Salon of Inventions and Innovative Technologies Archimedes 2021, and a grant from the President of the Russian Federation. We are sure that in the near future, MGD 34 will be in demand by all dentists and appreciated by their patients.